Let's be honest, modern medicine is broken. Patients are dismissed, doctors are exhausted, and mental health care is decades behind. So it's time to disrupt the status quo, to challenge a system that fragments care, dehumanizes patients, and burns out clinicians. I'm Dr. Georgine Nanos, and this is The Kind Revolution, a podcast about breaking old paradigms, rebuilding medicine with compassion and science, and reimagining what healthcare can be when we finally get it right. Because change is here and it's starting with us. Welcome to the revolution.
Welcome back to the show. September is National Suicide Prevention Month, and today we're having one of the most important conversations we've ever brought to this podcast. Here's why. Suicide is the second leading cause of death for kids ages 10 to 14, and among high school students, 1 in 5 has seriously considered it in the past year. And it's not just kids. Among adults, suicide rates have steadily been climbing, especially in middle-aged men and women. This is a crisis that crosses generations. But there's hope. Talking openly, breaking down stigma, and getting people connected to real help truly saves lives.
That's right, Lauren. The statistics are really staggering, and suicide is hard to talk about, but the silence is deadly. So today we're going to demystify what suicide really is, what depression really looks like, and how to recognize the risk, and what treatments, including advanced ones like TMS, can really make the difference between despair and recovery for people.
So let's start with the basics, because I think a lot of people use the word depression without really knowing what it means. How can you help us break this down?
Absolutely. Depression isn't just about feeling sad. We all feel sad sometimes. Major depression is actually a medical condition where the brain literally gets stuck in a state of low mood and hopelessness. It changes how people think, how they sleep, how they eat, and how they see themselves in the world. And there's some major signs to look out for. There is certainly that persistent sadness or emptiness that can last weeks or months. One of the most common signs is a loss of interest or pleasure in activities that once brought you joy. Just kind of that lack of motivation to do things you enjoy. Big changes in your sleep, and it can be either insomnia or oversleeping. Appetite changes, and again, that can swing both ways, eating too much or eating too little. Difficulty concentrating, making decisions, or remembering things. Physical symptoms like fatigue, headaches, that kind of thing, pain, sometimes with no clear cause. And then the most dangerous point is actually the thoughts of death or suicide. So what's important to remember is that depression is not a weakness. It is a real biological change that's happening in our brains. And it's not laziness, it's not a character flaw, it's a brain-based illness that really disrupts the way our circuitry communicates in our brain, just like diabetes disrupts insulin or asthma affects the lungs.
Yeah, I mean, I feel like that's so important because stigma tells people it's their fault when in reality, depression is a disease that deserves treatment just like any other disease.
Exactly. And one more really important thing that we all need to know is that depression is highly treatable. And that's what I want every listener to really hear. No matter how dark it feels, there are multiple paths to real recovery.
Yeah, wow. I mean, let's talk directly about suicide because this is where so many families they feel blindsided. And so why do people get to this point?
So, suicide is the tragic endpoint of untreated or undertreated suffering. And it doesn't mean someone wanted to die. It usually means they wanted the pain to stop and really couldn't see any other way out. So, I want to kind of address some of the common myths that we really need to break. One of the big ones is that talking about suicide puts the idea in someone's head. I can't tell you how many times I've heard this, but the real truth is that asking that question directly can save someone's life. It shows that you care and you're giving them the permission to be honest about their feelings. There's another myth that people who talk about suicide may be just seeking attention. Most people who die by suicide have told someone about it beforehand. So every single statement should be taken very seriously. Another common myth is that suicide happens without warning. The truth is, often there are lots of signs. It's that withdrawal, that hopelessness, that sudden calm after a deep despair. We sometimes see patients giving away their belongings, reckless behavior, life-threatening behavior. A dramatic increase in substance use can also be another sign. Another myth is that someone who's been suffering from depression, if they all of a sudden seem very happy again, that they're no longer at risk. The truth is, sometimes people appear much calmer once they've actually made the decision to end their life. And this can be a really critical danger point, too. So it's important to see suicide for what it is. It's not selfishness, but it's the result of an unbearable psychological pain.
Yeah, well, I mean, that's such a shift in perspective. So instead of blame, we just come from a place of like compassion, but also urgency, right?
Right. And so here's what I tell a lot of families: if your gut tells you something's wrong, you're probably right. So here are some warning signs to look out for: changes in mood or personality, withdrawing for family and friends, declining performance at work or at school, talking about hopelessness or talking about feeling like you're a burden to yourself, your family, your friends. And like we were saying before, increased use of alcohol or drugs, changes in sleep, or even subtle statements like everything would be better off or everyone would be better off without me. And for kids and teens, irritability, risk taking, suddenly giving away prized possessions can be real red flags. And for adults, it might look a little different, like overworking, self isolation, reckless spending. And sometimes these signs aren't always obvious, but the small changes add up. And that's why being observant and compassionate with our friends and loved ones really matters.
So if someone is worried, what is the right way to help?
The first step is to open the door gently. You might say, instead of saying, "What's wrong with you?" you might want to say, "I've noticed you don't quite seem yourself. I'm really worried about you." Or, "You're really important to me. I want to support you." And then listen, just listen. Don't try to fix, don't minimize, don't lecture. Just kind of hold that space for people. And if you're concerned about suicide, you can ask directly: "Are you thinking about hurting yourself? Are you thinking about suicide?" That might feel like a really scary question, but it does not increase the risk, I promise. It gives that person a chance to be honest. And if they say yes, don't panic. Stay calm, reassure them that you'll help, and connect them with professional care immediately.
Yeah, well, so let's give people some practical tools. If you're in a crisis or worried about someone, the fastest, most important number is 988. It's the Suicide and Crisis Lifeline. You can call or text them 24/7.
Yes, and there are also lots of local resources. The National Alliance for the Mentally Ill, those are called NAMI chapters, crisis centers. Lots of school counselors. Schools have counselors on site for their students, both in middle school, high school, elementary school, colleges. Those are everywhere now. Here at Kind Health Group and Kind TMS, we provide medication management as well as counseling and advanced options like TMS. And I want to emphasize this: you don't have to wait, nor should you wait until you're at this rock bottom point. The earlier you reach out, the easier it is to recover.
Yeah, and I really want to break down TMS because a lot of listeners, I feel like, may have never heard of it. What is it and why is it so important right now?
So TMS stands for Transcranial Magnetic Stimulation. It's an FDA approved non-invasive treatment for depression and a whole host of other mental health conditions. And here's how it works. In our brain, we have these anxiety and depression centers, and we all have this as humans. And when we're having any negative or stressful event or challenge or trauma from early childhood to our present day, we can develop these negative loops and you kind of get stuck in them. And that's normal. But sometimes it's really hard to get out of those loops. And so what TMS does is it uses super safe magnetic field energy to penetrate that area of the brain and create these new positive connections. So if you think of those depressive negative loops as like a traffic jam in your brain, TMS is building like new lanes of highway by building these new neural connections and increasing neuroplasticity so that after you finish a series of TMS treatments, you can then be able to better cope and have resilience and move past all of that painful discomfort with that negativity in your brain. It's super easy to administer and to tolerate. Patients sit comfortably in a chair. Treatments take about 5 to 10 minutes, and you're awake. There's no anesthesia, no sedation. It's very comfortable and it's safe. There's no long term side effects, and it's very, very effective, and it's evidence based. So, can't get better than that.
I love your traffic jam analogy. And then I also love the comparison you always say, which this isn't ECT, this isn't shock therapy.
Right. Exactly. That's a common fear. Unlike ECT, electric shock therapy, TMS does not cause seizures, doesn't require hospitalization, there's no memory loss. It's very gentle and safe. It's done as an outpatient in a clinic, and it fits into your daily life. You can just go about your day. In some cases, insurance will cover it. And in our newer accelerated protocols, like our 1-day protocol that we've been studying here at Kind TMS, we can bring relief to people in days instead of weeks or months. So the field is really evolving quite rapidly.
Yeah, that's amazing. And I know one of my favorite patient stories that you share is so pivotal, and I feel like such a great story that we should talk about on this episode. Would you mind showing us or telling us a little bit about our when we did the 5-day protocol about that life-changing first patient we had?
Yes, this is one of our first patients. His name is Casey. And Casey was 32 at the time that we treated him. Casey had long struggled with depression. He had been sexually abused as a child and like at 5 years old. It was very, very traumatic childhood, and had really been depressed and suicidal since the age of 7. I mean, just horrific. Casey had tried everything, medication, therapy, anything you can think of, he had tried. And he came to me really truly at the end of his rope in a way that I didn't anticipate. When we started his treatment on a Monday, and this is when we were doing the 5-day treatment that went from Monday to Friday, he just really quite frankly said to me, "Hey, if this doesn't work, I will be killing myself on Friday," which is just the most horrific thing you could possibly hear from someone. So obviously I was terrified and incredibly nervous about what was going to happen. But we treated him with this accelerated 5-day protocol, and he did absolutely fantastic. By the 5th day, by even the 3rd day, he was starting to kind of come out of it. The fog was starting to lift. He was starting to feel a little bit like himself. Now, granted, it wasn't an immediate reversal, but that suicidality was gone by the 5th day. And then eventually Casey was able to, I mean, this is a person who hadn't left their home in years, just was feeling super isolated. He has a full-time job. He's a mental health advocate. He's living on his own. Just, I mean, a complete life transformation. And it isn't just a miracle. It's really the result of evidence-backed science and treatments that really, really work.
Yeah, and I mean, as we should probably kind of wrap up here, but as we wrap up, let's leave our listeners with a clear takeaway. Notice, reach out, connect. Notice the changes in your loved ones, reach out with compassion, and connect them to help if they need it, whether that's 988, a therapist, or you can even contact us at Kind Health Group and Kind TMS.
Yes, depression and suicide can feel absolutely overwhelming, as they should, but you are not broken. You are not alone. There is help and there is recovery, and it is possible. So no one should have to go through this alone. Know that we're here to support you and that we're behind you every step of the way. And there's so many resources. So please, please reach out to a loved one. We are here for you as well.
Yes, and please share this episode because you never know whose life you might touch by spreading this message. And if you want to learn more about TMS or other treatment options, you can visit us at our website, kindtms.com. And together, hopefully, we can reduce the stigma, bring hope, and save lives.
Thanks for joining the Kind Revolution. If this gave you something real, hope, perspective, or a fresh way to think about health, please share it, subscribe, and pass it on. Medicine won't change on its own, but together we can reimagine it and build something smarter, kinder, and create a system that truly heals. This is the Kind Revolution with Dr. Nanos, where science meets compassion and the future of medicine gets brighter one conversation at a time. Thanks for joining the revolution.